trauma care is essential to prevent death and disability to injury victims. This care is started by the EMT that arrives on scene and continues while the patient is recovering. Lieutenant Colonel Charles Magruder, 358th Civil Affairs Battalion Preventative Medicine Officer, says his mission is to check hospitals in the Kurdish region to make sure they are up to World Health Organization standards for trauma care.
The World Health Organization has identified trauma response capabilities as an item of particular importance. So we want to begin in this area first and assess the current capabilities of the hospitals, and then once we have that information, then we'll be able to develop firm plans for how we can help them meet this current World Health Organization standards for trauma response and all of their different kinds of healthcare facilities.
The Kurdistan Minister of Health, Dr. Ryan Jones, tells us 7 of 10 people admitted into the hospital with trauma will die in Iraq.
It's embarrassing in a city of 1.5, 1.6 million population like Irbil and Suleimania, you don't have an ambulance service. We do have ambulances. They're scattered all around in the hospitals. They do transport patients between hospitals or take patients to home, but they don't have that duty to arrive at the site of accidents. In those critical moments, there is no well-trained staff who can do some management. I think those are the few critical moments where it can make the change in reducing the mortality rates.
Helping with trauma care could lower the mortality rate in this area of the world.
If we have facilities that meet World Health Organization standards for trauma response, then we hope to greatly reduce the mortality and morbidity associated with trauma.
For the 28th Public Affairs Detachment, Multinational Corps Iraq, I'm Specialist Chad Hyland, Irbil, Iraq.